This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Vasoglor A Combi Kit is a combination medication that plays a critical role in managing blood clot formation. Indications and uses. This medication is primarily indicated for the prevention of blood clot formation in individuals who have experienced heart attacks or strokes. It is commonly prescribed to reduce the risk of recurrent heart attacks, strokes, angina, or vascular blockages, particularly in patients who have undergone procedures like stent implantation or other interventions aimed at unclogging blocked blood vessels supplying the heart. How it works. The medication functions as an antiplatelet agent, effectively managing the clumping of platelets in the blood vessels, thereby decreasing the risk of clot formation and improving overall blood flow. Directions for use. Take the medication exactly as advised by your healthcare provider. It should be swallowed whole with a glass of water and not crushed or chewed. It can be taken with or without food. The dosage and duration will be determined by your doctor based on your age, body weight, and specific health condition. Never discontinue the medication without consulting your physician first. Possible side effects. Common side effects include indigestion, increased bleeding tendencies, joint pain, headache, and dizziness. Consult a doctor if these side effects persist or worsen. Precautions and warnings. Before starting treatment, it is essential to inform your healthcare provider about any pre-existing conditions, particularly liver, kidney, or heart issues. Those with a history of asthma, high blood pressure, or bleeding disorders should also discuss their medical history. This medication is contraindicated for pregnant or breastfeeding women and should be used cautiously in elderly patients. FAQs. 1. What is this medication used for? It reduces the risk of blood clots following heart-related procedures. 2. What are the common side effects? Increased bleeding tendency, indigestion, joint pain, and headaches are common. 3. Can I stop taking it if I feel better? No. Always consult your doctor before discontinuing. 4. What should I do if I miss a dose? Take it as soon as you remember but skip it if it's close to the next dose. 5. Does it affect my ability to drive? It may cause dizziness. Use caution when driving or operating machinery. Thank you for watching this video. If you have any questions or suggestions, please feel free to comment below.